Good afternoon. I'm Dr. Vishruth, Consultant Urologist and Uro-Oncologist at Aster RV Hospital, JP Nagar, Bangalore. Today I would like to talk about something very important for all the males. The topic for discussion today is circumcision. So as you all know, the surgical removal of the skin that covers the head of the penis is called as circumcision. There are lots of doubts, lots of controversies about whether it is really needed, what are the ways of doing it, what are the side effects, what are the benefits, what are the cons. All that I would like to cover and enlighten you with a very short and precise talk. So firstly, as you know, circumcision is done for all Muslims and all Jews across the world in all male children as soon as they are born. So is this just for religious reasons or is there a scientific basis to this? The answer to that is yes, absolutely, 100% there is a definite scientific basis as to why all male children will be benefited by undergoing a circumcision. In the US, 80% of all male children undergo a circumcision before they reach the age of 1 year. This leads us to what are the benefits of circumcision. The most important benefit of circumcision is, of course, maintaining local hygiene. As we all know, because of the skin that covers the head of the penis, there is a potential space there in which bacteria, fungi, sperms, urine, dead cells, dirt, everything can accumulate and cause various problems. So these problems can range anywhere between fungal infections on the head of the penis to even development of cancer of the head of the penis, as well as cancer in the female partner in the form of cervical cancer. Increased risk of sexually transmitted diseases can be there. Multiple urinary tract infections can also be a recurrent problem. For all these reasons, it is advised that men undergo elective circumcision, and the guidelines so far suggest that if circumcision is done at a younger age, the side effects and problems are much lesser. So moving on, I just told you about the benefits of circumcision. What are the harmful effects? As such, there are no reported harmful effects of circumcision. Like all surgical procedures, the only problems can be a little bleeding and a little infection at the local area. Other than this, there has been no reported major side effects to undergoing circumcision. What are the ways of doing circumcision would be the logical next question. There are mainly, as you might have seen on all sorts of social media, there are mainly three ways of doing a circumcision. One is the routine circumcision, where we use a knife to cut the foreskin. The other one is a laser circumcision, where we use a laser to cut the skin. And the latest and the most advanced one, which has come now, is called a stapler circumcision, where we use a ready-made stapler which staples as well as cuts the foreskin and provides a beautiful cosmetic result. So the reason why we have chosen this topic today is that stapler circumcision is now become available at Aster RV Hospital, and we are doing it on a daily basis, on a day-to-day basis, and there have been fantastic results. With stapler circumcision, there is no need to remove the sutures. The skin staples fall off on their own. There is very minimal bleeding. There is very minimal post-op pain, and the patient can go back to work or to school almost the very next day. And the admission time and the discharge time also is quite small, and it is reasonably cost effective. So these are the benefits of undergoing a stapler circumcision. However, the urologist will first examine the patient and then decide which form of circumcision will best suit that particular patient. That decision has to be taken by the operating surgeon. So thank you. I hope I was able to provide some information about the basics of circumcision and why it is very important for all parents to consider getting their male child circumcised. We are always available for you at Aster RV Hospital, JP Nagar, Bangalore. Thank you.